According to the medical textbook Primary Care Geriatrics, pressure sores are graphic, ugly, smelly evidence of a healthcare provider's failure to take good enough care of the elderly. Whether called bed sores, pressure wounds, or decubitus ulcers, nursing home residents who suffer skin breakdown are at risk for infection and death. The minute you learn your family member is suffering from skin breakdown, you must demand to see the area, and do not be afraid to take pictures. It may be uncomfortable at first, but that will pass, and pictures are your best evidence of neglect. Bed sores are caused by a combination of several well-known and understood factors: immobility, moisture, poor nutrition, limited sensory perception, and friction and shear. The easiest of these risk factors for the family members to identify are immobility, moisture, usually from urine or feces, and inadequate nutrition. Immobility is just what it sounds like. Is your loved one mostly in a bed, a wheelchair, or a recliner? If so, they have limited mobility. People with limited mobility need to be turned and repositioned every 2 hours. This simple action relieves pressure on the bony prominences of the body and allows adequate blood flow. Without proper blood flow, the skin dies and breaks down. In addition to turning and repositioning, there are a number of products for beds and chairs that reduce pressure. Demand one for your loved one. Moisture from being left in urine or feces is another easily preventable situation that leads to bed sores. In addition to the effects of moisture on the skin, think of soaking in a bathtub for too long, urine and feces are caustic substances which themselves cause damage to the skin. For those with existing skin breakdown, being left in urine or feces is a surefire way to get an infected wound. Infection can prevent a wound from healing and spread throughout the rest of the body. Your body needs protein, vitamins, and minerals to stay healthy. When your body doesn't get enough nutrition, it begins to fail. Bed sores are a common result of a nursing home's failure to provide sufficient nutrition to residents. As soon as you notice your loved one losing weight, you need to be on the lookout for bed sores. Bed sores are described using a staging system from 1 to 4, with 4 being the most serious. It is easier to prevent a bed sore than it is to heal one. If identified and treated in the first or second stage, bed sores are more easily healed. Stage 3 and 4 wounds can take months or even years to heal, if they can be healed at all. Wounds can cause infection of the blood, tissue, and bone, which cause the body to fail and can result in death. It is imperative that you recognize the risks and demand the care your loved one needs to prevent or heal bed sores.